Hey guys, Oscar here with Gastroenterology Simplified. I'm a board certified physician assistant, and today we're going to talk about Mallory-Weiss tear. Before we go any further, I need you to understand that this video is for educational purposes only. If you have any questions or concerns, please contact your primary care physician or physician assistant. Mallory-Weiss tear is one of the most common causes of upper GI bleed. The bleed happens due to a tear in the distal esophagus, at the GE junction, at the gastroesophageal junction, and this usually happens after the patient has been experiencing a bout of nausea, vomiting, retching, intractable nausea and vomiting. It usually occurs after the patient has had quite too many alcoholic drinks. It usually happens when the patient has a history of portal hypertension. Bleeding occurs when there is a tear that involves the underlying venous or arterial plexus. Clinical manifestation. Usually, a middle-aged man presents to the ER with episodes of intractable nausea, vomiting, retching, and hematemesis, which is vomiting blood. Usually, the patient has had quite too many alcoholic drinks. Something that you need to be extremely aware of is that the patient does not have a history or has a history of liver cirrhosis, because the patient could be bleeding from an esophageal varix or a gastric varix, and this is extremely dangerous. If the patient happens to have a history of liver cirrhosis, make sure that your hospital has IR, and hepatology may need to be involved in this type of cases. Diagnosis. The diagnosis is made with an upper endoscopy, an EGD, which is a scope that goes down your mouth, your esophagus, all the way to your stomach. We'll take a look at your esophagus, and usually the findings are consistent with an elongated or an elliptical ulcer at the GE junction, the distal esophagus. Treatment. Most of the tears heal on their own. Starting an acid-reducing medication, such as Protonix, omeprazole, pantoprazole, may speed up the healing process. Sometimes during an upper endoscopy, the patient may need thermal coagulation to stop the bleeding, but most importantly, the patient will need to stop the offending agent, in this case, the alcoholic drinks. Also, the patient will need antiemetics, which is nausea medication, to make sure that the patient does not continue to vomit. Also, the patient will need hydration as well. In conclusion, a Mallory-Weiss tear is a tear at the distal esophagus, at the gastroesophageal junction, that happens when the patient has been experiencing nausea, vomiting, retching, or intractable nausea and vomiting. Usually this happens when the patient has had quite too many drinks, alcoholic drinks, and may occur in patients that have a history of portal hypertension. Something that you need to be aware is that to make sure that the patient does not have a history of liver cirrhosis, because the patient could be bleeding from gastric varices or esophageal varices. This is extremely dangerous. The way you're going to diagnose it is by doing an upper endoscopy, which will show the elongated or elliptical tear at the distal esophagus, gastroesophageal junction. And usually the tears heal on their own. Sometimes you may need some coagulation, some thermal coagulation. And starting Protonix, omeprazole, pantoprazole will speed up the healing process. Guys, if you found this video helpful, click like, subscribe, share the video. And if you have any diagnosis that you want me to explain in simple terms, please put it in the comments below, and I will be more than happy to explain it. All right, I'll see you in the next one. Bye.